This course content is situated within the study of health communication. Health communication is a subset of the larger communication discipline. This interactive lecture will provide an overview of health communication, specifically focusing on how interpersonal interaction is important to the study of how we communicate about health. To the everyday person, health communication is often thought to be exclusively communication that occurs in healthcare settings. And while this is a large and important area of the study of health communication, you will learn in this lecture and in your readings for this week that health communication encompasses much more than the interactions that occur between healthcare professionals or between patients and their providers. The study of health communication is known to be interdisciplinary. This means that our understanding of what health communication is and what is included or excluded comes from many areas of study or perspectives. For example, health communication research can include contributions from scholars in many different disciplines, including psychology, business, education, public health, nursing, philosophy, sociology, political science, and engineering and technology. That's just to name a few. Your readings also discuss the diversity of health communication scholarship. For example, health communication is important for relational, therapeutic, and pathological outcomes in healthcare settings, health promotion campaigns to promote public health, public advocacy for equalizing power in healthcare for marginalized groups, improving healthcare technologies, and understanding the influence of everyday interaction on health behavior and outcomes. Health communications focus on health promotion and prevention, and improving communication in healthcare settings can lead some to think that health communication serves only positive purposes, or that there is a remedy for all issues or challenges in the healthcare context. This avenue of thought is often referred to as the ideology of health communication. Unfortunately, this line of thinking ignores the sometimes dysfunctional, destructive, and risk-promoting communication processes that surround health communication. In other words, communication can also prevent health as opposed to promoting it, and it can increase health risk as opposed to preventing it. For example, some health conditions are negatively stigmatized, including mental health, and we'll talk about more about stigmatization of mental health in week 4 of this class. The stigmatization of illness can influence the positive impact of communication about this disease. A student diagnosed with severe depression and anxiety may be encouraged to tell their friends and family about their illness because it may help them manage their illness. However, telling others about their illness, especially one that can be stigmatized, may open the student up to criticism, teasing, and the loss of social support, which can have negative impacts on their health. The phenomena of illness stigmatization represents the third characteristic of health communication. It includes messages and their meanings. In other words, messages are a configuration of symbols which constitute a basis for meaning and action. These meanings can be both subjective, or the product of personal experience, or intersubjective, the product of social negotiation. Thus, message meanings are often complex, going beyond a message's content or informational meaning to include interpretive meanings or messages about how to take the message, and relational or identity meanings. So in our prior example, the student's message to others about their mental illness serves the informational meaning about the illness and needs to help manage it. However, the same message and the recipient's response also communicates information about the relationship between communicators, also known as the relational meaning. For example, it may communicate that I trust you with this private information. The message can also carry meaning about the person's identity. For example, being diagnosed with this illness is part of who I am as a person. Together, these meanings influence the interaction with others about our health and our perceptions of how well or how poorly we communicate about our health with others. The informational, relational, and identity meanings are often socially constructed within the social systems that communicators are embedded. Social systems include what occurs within the social unit and between or among participants in that unit. Thus, a systems approach to understanding communication consists of the interdependence, mutual influence, and relationships among supersystems, or the communities, families, social networks, or organizations that individual members are a part of, and the subsystems, or the people and health messages that exist within suprasystems. In other words, suprasystems are at the macro level, and subsystems are at the micro level of understanding. Both macro-level and micro-level systems are important for understanding health communication processes. For example, at the micro level, what both parties are doing and saying relative to each other creates relationships and drives health and risk outcomes. Further, these interactions are embedded in larger social systems, for example, the healthcare system, that influence micro-level communication behaviors. Both macro and micro level systems are important for assigning meaning to messages, and those systems often influence one another. For example, the meaning that we associate with mental illness within our interpersonal interactions may be influenced by the larger systems that we are part of. For example, our society or our workplace. The final characteristic of health communication is that it influences our health. Health communication includes both formal and informal messages that influence health. For example, health campaigns are strategically designed to accomplish some goal or task, which often promotes health behavior or prevents risk-taking behavior. Think about the anti-smoking health campaigns. These ads and messages are carefully designed with the intention of preventing individuals from starting smoking. Similarly, not smoking has a positive impact on our general health. However, health messages can occur in more informal situations or in our everyday communication with others. These messages are often in the mundane interactions we have with our peers, our friends, our family, and our coworkers. Everyday health communication is often very powerful and persuasive despite its unintentional and often informal presentation. The rest of this lecture will focus on this everyday health communication in our relationships. Our everyday communication with others influences our health in a variety of ways. First, our health conditions may create a need for extra support from others, like our friends and family. Support can be in the form of informational support, or providing useful information about our health condition, emotional support, also known as the ability to help us cope with our disease or illness, and financial or tangible support. This would involve providing resources that help us manage our illness. All forms of support can be very beneficial for our mental and physical health, but support can sometimes be unhelpful. For example, support can help us obtain new helpful health information, cope with our illness, and provide important resources to help us manage the illness. However, the support can also increase risk-taking, lead to actions through coercion or excessive persuasion, and can provide an overload of resources that are just not needed. We will talk a lot more about the influence of social support in weeks 6 and 7 of this course. Second, everyday communication, whether intentional or unintentional, can have a strong influence over our behavior. One theory that helps us understand this effect is social influence theory. Social influence theory focuses on participants' social realities and social norms, with implications for understanding messages and meanings from their viewpoint. This perspective embraces the view that substantial influence occurs in the context of everyday interpersonal communication. Furthermore, that influence can have both positive and negative impacts on one's health. Specifically, socially constructed realities provide blueprints for formulating meaning and guiding behavior in our everyday interactions, and they function to create a shared sense of reality. In other words, our everyday language plays a critical role in socially constructing realities, including those surrounding health and risk. Earlier, I talked about stigmas that are associated with some health conditions. These stigmas are often socially constructed through language. Furthermore, our everyday communication with others can work to perpetuate and spread health stigmas. Ironically, it is only through language and communication that we can change the social reality surrounding stigmatization of illness. Our shared social realities help to shape our social norms that guide everyday interaction. Social norms result from a shared sense of oughtness or appropriateness of behavior, including appropriate reactions to specific health states and diseases. Thus, while our social realities shape our health labels, including stigmas, as well as our understanding of how we should respond or behave, or the social norms we have. In other words, labels may invoke blame or innocence, community or division, and identify those who should experience empathy versus stigmatization from others.